Dr. Henry, as the province prepares to immunize children, can you give us an update on where kids may be able to get their vaccine? Is the province considering using doctors' offices, schools, community halls? How is that going to work? And how will priority be established for kids? Will we start with 11-year-olds and work down to 5-year-olds, or will it be based on regions, based on virus transmission?
We are still in the organizing and planning phase of that. To answer the second question first, no, it won't be. Often families have more than one child, so it will be all of that group. There's about 340,000 children between 5 and 11 across British Columbia. So yes, of course, we'll be highlighting communities where transmission risk is highest. That will be important, but we're trying to do a broad-based approach across the province to make sure access is there for everybody when the vaccine is available. And we'll be taking a number of different approaches. It probably will not be in physicians' offices yet. We're still waiting for details of whether the vaccine is going to be fridge stable and for how long. We had some early indications it might be, but right now we're hearing that it will need to be transported frozen and it will have a limited time in the fridge, but we don't know those details yet. So those are all things that we need to factor in to play. But the other really important thing, and this has been important from the very beginning of this program, is making sure that we can document in our provincial immunization registry every dose that each individual has had. And I know there's been a few challenges, but our BC vaccine card is a good example of that. We know that that works because it is able to get that information from individual basis. And that's really important. It's really important so that we can monitor safety of vaccines and effectiveness of the vaccines. So we do not yet have a way for average physicians' offices to be able to enter the information directly into the immunization registry. However, we do know that physicians are really great at giving immunizations to children, and they've been a huge part of our mass immunization clinics. So I expect there'll still be a role for physician immunizers, but also the other immunizers who now are very experienced with the COVID vaccines. And so our immunization program, Dr. Ballum is working with our teams across the province to look at, to determine what is the best approach for different communities. For some communities, some of our more remote communities, we may be able to go in and offer, for example, a booster dose, making sure as well that we offer first and second doses for adults at the same time as being able to offer vaccination for younger children and do a whole of community approach. We know that was very effective for many First Nations and other smaller and more remote communities. So it's going to be a whole variety of different approaches. There will be some pharmacies that will be involved, but also health authority clinics in various different settings.
Richard, did you have a follow-up?
With October 24th fast approaching, proof of 2 shots for the vaccine card, what consideration is being given to event capacity? Has BC made a decision yet on whether we are going to expand capacity at that point, considering we're the only province this side of the Maritimes that has not increased the capacities to 100% in cities where there are NHL teams? So what's BC doing about capacity limits?
Yeah, those are things that I'm actively working on. Our intent was always, when the full vaccine card came into effect, that we would be able to go to 100% capacity and take away some of the other restrictions that we have in some events, like around dancing and remaining seated. So those are things we're looking at. Looking at the epidemiology in different parts of the province and where this might not be in effect, and seeing the situation in the north comes to mind. So we will be making a decision about that by the end of this week. I know that people need to have some time to plan, but we are actively looking at that right now.